Good evening. I'm Dr. Prasenjit Sarkar. I'm a critical care head and chairman of Infection Control Committee at ILS Hospitals, Dublin. Today, I'll be talking on sepsis. You all know that 13 September was observed as a World Sepsis Day, and people should aware regarding the sepsis or septicemia. This is nowadays the most common threat of death and hospitalizations among the most of the populations in our country and all of the world. WHO called a global action on it because sepsis causes death in 1 out of 5 patients get admitted. Every year, almost 11 million people uh, succumb due to septicemia or sepsis. Oh, what is sepsis? This is a bloodstream infections, and from 2016 onwards, the definition has been changed. It was earlier it was a SARS or systemic inflammatory response based definition, and now it is organ dysfunction based definition. So this is a dysregulated host response toward infections leading to life-threatening organ dysfunction, and if blood pressure goes down below 90 systolic blood pressure less than 90 millimeter of mercury, along with the increased level of lactate that is more than 4 millimole, then it is called septic shock. So all other classification has been abolished from the definition. So now there is only sepsis and septic shock. So sepsis itself a serious disease. So severe sepsis and multi-organ dysfunctions all have been removed from the definition itself. And septic shock means it is almost synonymous to death. It is more than 90% chances of death. So obviously this is very serious. Now the question is how people will pick up. So for common people and candidates, those who are getting admitted in general ward, not in critical care units, for them there is a quick scoring system that is called QSOFA. SOFA means this is sequential organ function assessment, and there is an elaborate SOFA scoring usually has been done in critical care units. For easier formulation, there is a QSOFA has been introduced, and there is only 3 parameters. One is the sensorium, whether it is altered or not. Number 1 point is either yes or no. Number 2 is the blood pressure. If the systolic blood pressure less than 100, then also 1 point for that, and respiratory rate more than 22 means another 1 point. So if there is a 2 or more QSOFA along with suspected or proven infection means this is sepsis. So what is the most important part of early picking up the sepsis? Because to institute the appropriate antimicrobials. So antibiotics or antifungals. So in sepsis, first you have to think of it, then you have to send appropriate cultures, and you have to start antimicrobials as soon as possible, and that only can salvage the patient. All over the world, there is an unanimous guideline, that is a survival sepsis campaign, and that also endorses that you have to take the cultures early and you have to institute antimicrobials as soon as possible. So take home message is think sepsis, not start antibiotic overzealously, but you have to pick up, you have to send appropriate cultures, and you have to start antimicrobials in an appropriate way according to antimicrobial stewardship program of the institutions of your institution. Thank you so much.